Good afternoon, everyone, and welcome to today's quiz show with Dr. Murali Bharadwaz for the NEET PG preparation. The warriors, Sairam, Dikshi, Ramya, Rekha, Avijit, Shilpa. Wow. Come on, guys. Invite your friends. Sorry, I was a little late by about 1 hour. Supposed to start at 11 o'clock. But life is not that predictable as what we think. Even you also plan a lot to prepare for the entrance. But we are all living an adult life. In the adult life, unlike our childhood, there are so many pushes and pulls. Some patients delay us, some situations delay us, but better late than never in the game. So we are going to rock a rapid fire show in obstetrics. We have edge of the seat excitement with 25 classical questions. Let me see who is going to take away that 40,000 rupees worth of onlinembbs.com video library as a prize by coming to the top position. I'm able to see almost 29 players. Please invite your friends. Once we have 40 players, we will start. Let us give 2-3 minutes time.
phone ಕೊಟ್ಟಿರ್ತೀನಿ
So let's join the game, doctor. A 27-year-old woman in 18th week of her pregnancy. Both the patient and her husband are heterogeneous for sickle cell gene. How do you want to evaluate? Is a very important question. Very good. 9 of you have correctly answered. Amniocentesis or chorionic villus sampling is the best thing. That's good. Sam is on the top. Question 2. A 25-year-old woman married to her first cousin. Consanguineous marriage. Autosomal recessive disorders are very common. How do you want to antenatally evaluate for a prenatal diagnosis? Great. This is one of the important risk factors for condition like trisomies. So the maternal serum alpha fetoprotein, MSAFP, is the one which you need to look for. Very good. That makes Sam, Pravalika, Srihan on the top of the list. Very good. I'm so happy. 41 online players. Wonderful. A 29-year-old previously had a child with microcephaly. How do you want to make an antenatal diagnosis? Prenatal evaluation. Wow. Specialized fetal ultrasound is considered to be the investigation of choice in this given scenario. Good. That keeps Sam rocking the game. Brahmi, Avijit, Sabir. We have a very large number of players. But you are given 12 seconds time. Within the 12 seconds, you need to punch your answer. Okay? So be ready on your smartphone to bump your answer. A 22-year-old woman in her 10th week of pregnancy, whose husband is having a familial balanced translocation. How do you want to evaluate? Great. That is an indication for amniocentesis or chorionic villus sampling. Superb. Now, just you need to enlarge it on your slide. A 25-year-old primary gravida at 14 weeks was told that she has a 75% chance. So how do you want to evaluate her? Yes. Considering her gestational age, chorionic villus sampling is indicated. Very good, Sam. Now, a 24-year-old pregnant lady with sickle cell anemia want to know, hey doc, is my baby going to have the sickle HB? How do you do antenatal evaluation? Great. Cardosynthesis. 11 of you have completely clean ball by saying clean Hoyer. Clean Hoyer is to know the feto-maternal hemorrhage whenever there is any RH iso immunization. Not in this scenario. Okay? Acha, you have seen the hemoglobin word and jump to clean Hoyer, right? No. Good. Brahmi is really rocking. Pravalika, Rekha, Srihan, Kirti, Avijit, Harsha, Dikshi, Sneha, very good. Shivashankari, Sairam, Shilpa, excellent. Question 7. A 31-week pregnant female had an episode of antepartum hemorrhage. A detailed ultrasound shows grossly retarded fetus without any physical abnormality. So how do you want to evaluate? Yes. So any episode of antepartum hemorrhage is a risk for the feto-maternal hemorrhage. So clean Hoyer's test. Good. Only VLS and Sam could be able to answer it correctly. Now, 34-year-old RH negative female has isoimmunization in her last pregnancy. Biophysical profile shows a edematous fetus. How do you want to evaluate? That's great. Once more, this is a scenario where you require clean Hoyer's test. Good. That makes Harsha to swell to 285 points. Let us see. Can Harsha, Sabir, Avijit, Rekha can be able to reach and topple Sam? Now, still there are 16 questions for you to fight. How do you manage transverse arrest? Transverse arrest is managed by great. It's an indication for cesarean. Absolutely. Whoa. Sam missed that. But Brahmi, VLS, Harsha, everyone racing fast. They are the fast moving jockeys. Now, let us see. Question number 10. Cord prolapse during second stage. How are you going to manage? Cord prolapse is there, second stage of labor. How do you want to manage? Boom, boom, boom. It is one of the indications for instrumental podalic version. Okay. Now, the next question. Question number 11. Occipito posterior presentation. How are you going to deliver? Occipito-posterior position presentation. Great. Occipito-posterior presentation can still be tried with a normal vaginal delivery with a close monitoring. Wow, that's good. Sam, Brahmi, Abhijit, everyone is right. The first twin in the transverse position, how do you want to deliver? The first twin in transverse position. I want to once more tell all of you, by playing the quiz, you will be reminded a truth about the NEET PG exam or FMG. Obstetrics may all these various abnormal labor you have to master. Definitely question either. If you have done this correct, great. But if you are getting repeatedly clean bold and a lot of our classmates are able to crack it, that should be an inspiration for you to go back and master the very important chapter, abnormal labor. Deal? So you should all take in that spirit. Then you will enjoy this game. Okay? So our next quiz is on nephrology at evening 4 p.m. So you have another 3-4 hours time. What will you do in that time? What all the topics that you are clean bold in this quiz, you should take it in a positive spirit. Go back to the onlinemmbbs.com video library in the obstetrics, pick up that 30-minute, 40-minute lecture on abnormal labor and do a quick revision. So that way, 10 a.m., 2 p.m., 6 p.m., night 10 p.m., for every 4 hours gap, we are setting up a rapid fire quiz in order to make you play extempore, so that your preparation is accompanied by Dr. Murali Bharadwaz throughout the day, stimulating you, exciting you, inspiring you to go back and prepare those topics where you are getting clean bold and butchered in the quiz program. Okay? So, very good. Now, that makes Sam enviously high, followed by Brahmi, Avijit, Rekha. Wonderful. Now, the next question. Chord presentation. How do you want to clinically manage chord presentation? Is it cesarean, normal vaginal, podiatric, or extrancephalic? Cesarean, it's an indication for cesarean. It's called double setup. So even after the fetal head is engaged, if the cord is still holding it, then you need to move the patient from the labor room into the OT, and then you need to pull out that engaged baby and deliver through the cesarean. That is called. Now, wow, that's great. Question number 14. Mento anterior presentation. How do you want to manage? Good to see 40 online students in this wonderful afternoon of the supposed to be rainy season, but rains are not that big. Only 5 of you correctly answered. It's an indication for internal podiatric delivery. Only ABC correctly answered. Now, second twin in the transverse position. First twin is cesarean. Second twin in transverse position. How do you want to deliver? Great. Internal podiatric delivery is considered to be the best way by which the second twin in transverse position is delivered. Good. Rekha and Dikshi are really racing very fast in order to catch up with Sam. Now, a 21-year-old woman presents to the emergency with a 4-hour history of lower abdominal pain, bright red vaginal blood loss. She has 9 weeks of amenorrhea. So considering all this story, what does it define? Beautiful. 19 of you are right. Inevitable miscarriage. Once but the table is there, no doctor. Threatened abortion. If cervical os is open, closed, how will you define? Favorite topic of the examiner. Very good. Avijit is standing on the top. Very good, Avijit. A 16-year-old woman presents with a sudden onset of severe right iliac fossa pain. On examination, there is a 6 centimeter echogenic cystic mass. So, what is your diagnosis of this? Punch, punch, punch. Great, doctor. It is a normal pregnancy. Only 6 of you are right. Tricky question, huh? Yeah, that's right. So, Avijit as usually rocks. Brahmi also scored 70 plus. Oh, Sam lost it. Okay, now question number 18. Eighteen-year-old student she missed her period and pregnancy test is negative. Given the history, what is your diagnosis? What is your diagnosis? Most of you thought it as torted ovarian mass. No. It's a very close differential that you have missed it. So, only Rekha correctly guessed the irritable bowel syndrome. Very good. Question number 19. A 22-year-old woman who has 2 terminations of pregnancy says she is once more pregnant. She noted a small amount of watery brown discharge and there is tenderness in her right iliac fossa. What is your diagnosis? Hey, that's right. It is ectopic pregnancy. Only 8 of you have rightly cracked the diagnosis. That brings back the glory of Sam. Sam is on the top. Alladi Vinay is asking, sir, increase the time for long questions. Yesterday, Navina wrote a nice 1 paragraph length compliment. I'm so happy to see that. My videos are not that commented. Lot of other people videos are commented. I surprised why. Either I'm good or I'm too bad. I don't know. So, yes. So that's the reason long questions we created 15 seconds. That itself is too long. Already we have increased the time. Now, a 27-year-old woman uses OCPs presenting with intermittent vaginal bleeding, malodorous discharge. She has pain all over the lower abdomen. Thank you, Sindhu, for a good compliment. Every human being get inspired by a good compliment. There is no, even tomorrow your patients also, you have to compliment them for their fever coming down, right? So when you do rounds, you should discover the gleam of smile in every patient's face. That can only happen if you make complimenting a habit. Of course, not a false flattery, but for something that really worth getting commented. Yeah. So pelvic inflammatory disease, great. So Sam is on the top, Abhijit and Brahmi. Oh, we have 42 players. Excellent. Today afternoon, 4 p.m., we have a rocking nephrology rapid fire session. Please bring another 100 of your friends. Please post this YouTube link in your classmates WhatsApp group and the various study groups where you are part of. There are many coaching centers with study groups. Please put it in them and invite more to join this, and let us make it viral. And throughout the day, with about 4 to 5 quizzes, rapid fire quizzes, I promise to inspire you throughout the day until you get the seat. Right? So now, doctor, last 5 questions going to decide. Placenta associated with Siamese twins fused at the abdomen. What type of placenta will lead to Siamese twins fused at the abdomen? Monoamniotic, monochorionic twin placenta is the one which you expect. Very good. That's good. Rekha is really good in obstetrics. So a very close threat for the crown of Sam. Let us see. But you need to keep on 200 pages notebook. After the quiz is over, make it a point. Now, painful vaginal bleeding in a woman who is a cocaine addict. What is the possibility? What type of placenta? That's right. Painful. Abruptio is painful. That is a close important thing. 17 of you who did wrong. You need to quickly jump on to onlinembbs.com video library and do a revision of obstetrics. We had an excellent teacher called Dr. Shilpa Reddy and Dr. Apeksha Sharma from Jaipur. And I myself also taught one session of complete revision of obstetrics. And very recently, we discussed almost 1200 MCQs on the same YouTube channel. These 1200 MCQs are archived. around 40 hours of discussion. Please take every chance to do the revision. You have everything that you require for obstetrics revision in there are totally 60 high-yield topics in the onlineMBBS.com video library. So please call 9000868356. By now you understood that we are by nature not very commercial. We allow more number of students to be benefited by the online MBBS video library. So whatever the price that you can afford to pay, we are more than happy to offer. So please call our helpline. Thank you, Dr. Shweta Reddy. Watching the audience is easier, but playing the game is the real deal. It shows the preparedness. So these quizzes are great. Thank you so much. So, and thanks for all of you for so encouragingly every time joining, even if I'm a little late by 1 or 2 hours, once more coming and rejoining. That's beautiful. So that's good. Sam is rocking. Harsha is ready to give a bloodless coup to Sham. So question number 23, last 3 questions. And 4 topics I gave you to as a homework for you to do the revision. Absence of the decidua bisalis leading to severe postpartum bleeding. Where do you see? Great. Placenta excreta. Absolutely right. So that makes Sam, Abhijit, Harsha, Rekha. We will see who is going to be the winner in the last 2 questions. And the winner gets 40,000 rupees worth of onlineMBBS.com video library containing 3,000 video lectures, 30,000 MCQs, topic-wise Q scanner, 65 full-scale grant tests and discussions, 1 lakh PowerPoint slides of notes, all yours, whoever become topper in any of our quiz tournaments. So, Doctor, question 24. Placenta with painless bleeding and abnormal implantation site. I know all of you will rock this. Very easy question. Punch, punch, punch. Whoever punches very forced. Yes, absolutely. 23 of you rightly answered. Painless bleeding, abnormal implantation site. That makes placenta previa. Very good. Rekha punched the fastest of everybody. The correct answer. That's good, Rekha. Let us see 2 more questions. Right? Cardiotoxic Medico is asking, sir, please increase time. Rekha, there are 2 ways by which endocrinologists treat hormonal disorders. Pulsatile release, continuous release. Pulsatile release only stimulates. Similarly, 10 to 15 seconds is the most optimum time that you will make your mind to race. That's the point. You'll get habituated. Now, doctor, the last question. Going to decide who is the winner. Umbilical cord inserts into the side of the placenta. Whoever punches fast, the correct answer. Only correct, only correct, only winner. Who is that? Wow, that is called battle door placenta. 25 of you correctly answered. Let us see. Oh, that's good. Sam, Sam, Sam. Sam is the winner. Very good. Sam, please take a screenshot. Send to our helpline 9000 868-356 and get 40,000 rupees worth of online MBBS.com video library test series subscription. And the remaining also, you all know, we want more students to get benefited. So please give a call to our helpline. You have a surprise discount waiting for you, only for you, for having joined Dr. Murali Bharadwaz quiz show. Once more at 4 o'clock, please don't forget, keep a bell sign, be part of our Telegram and WhatsApp study group to get the notification. We will play nephrology quiz with a rapid fire 30 questions. Till then, enjoy a great time of preparation. Every moment, every hour, every whistle of the breeze flowing across your reading room, touching your cheek. This time doesn't come back. Tomorrow when you become consultants, you will feel nostalgic. Hey, those days we used to play Dr. Murali Bharadwaz quizzes, right? How nice it used to be, those preparation days. One day you will definitely feel, after becoming a topper, becoming a busy consultant, right? So, see you all at 4 p.m. Thank you.